Mr. Speaker. The infant mortality rate is generally considered a good marker of the overall health of children. Sadly, Manitoba's infant mortality rates are extremely high. The Canadian average is about 5 deaths per 1,000, but in northern Manitoba, it is much higher at 9.2 deaths per 1,000 live births. In inner-city neighbourhood, it is also high. I asked the Minister of Health, can she give specific reasons why, after the NDP's 13 years in power, the health of children and the infant mortality rates in Manitoba are among the worst in Canada?
Yes, thank you very much, Mr. Speaker. We know that we want all moms and families and babies to have access to good care here in Manitoba. And we certainly know that part of our investment in ensuring that moms get the best possible attention during their pregnancy is that we've invested in the prenatal benefit, Mr. Speaker, to ensure that we can provide additional financial assistance for healthy nutrition during pregnancy. We offer nutrition programs, Mr. Speaker, to expectant moms through Healthy Baby and our community support programs. And we also know, Mr. Speaker, that we have indeed seen through the Public Health Agency of Canada's study improved access to midwives, improved access to family doctors, and we're going to continue on that journey, Mr. Speaker.
Mr. Speaker, when you average infant mortality rates across the country over the last 3 years, Manitoba has the worst infant mortality rate in Canada at 6.7 out of 100 births. I've called upon the NDP on numerous occasions to raise shelter rates for low-income Manitobans for years, and yet they've refused. They simply continue with ineffective policies, leaving children with poor nutrition and mothers with inadequate prenatal care. I asked the Minister of Health what new specific measures that are actually effective will she ensure that the NDP take this year to lower the infant mortality rates, particularly in northern communities and in inner Winnipeg?
Yes, thank you very much, Mr. Speaker. And in addition to our investments in the prenatal benefit, our investments in the Healthy Baby program, the Public Health Agency indeed does report that, contrary to sounds from the members opposite, Manitoba actually has the lowest proportion of mothers who do indeed have to travel to give birth at 22.2%, below the national average of 25%. And more mothers, Mr. Speaker, are contacted at home by a healthcare provider after the birth, 98.5% in Manitoba versus 93% nationally, and this was sooner after discharge than the rest of Canada. So we're providing more follow-up, faster, and more prenatal care. We have work to do. I concede this point, Mr. Speaker, but we're committed to do it.
Mr. Speaker, one of the reasons for high infant mortality rate is clearly because of poor housing conditions available with the meager shelter rates this NDP government provides. One of the reasons is the fact that we've got more than 1,000 homes in northern Manitoba without clean running water. I asked the Minister of Health, what efforts has she made to ensure that the Premier allocated in this year's budget enough funds to retrofit homes in northern Manitoba so that more families can have clean running water?
Well, thank you very much, Mr. Speaker. And without a doubt, the member, as a pediatrician himself, knows that the social determinants of health play a hugely important role in the development of our children and indeed the health of our expectant moms. It's why we're investing in our Healthy Baby programs. It's why we have a committee like the Healthy Child Committee of Cabinet that's looking not only at the nutrition, but at physical fitness, at access to a family doctor, and ensuring that we provide even more health care through midwives, through physician assistants, through community mental health workers, a variety of circumstances in the north and indeed throughout Winnipeg. As a nation, Mr. Speaker, we have more work to do. We just need to be committed to do it and not decide to make indiscriminate cuts to try to balance a budget, Mr. Speaker.